But our big story tonight is India's COVID crisis that worsens now by the day. Active cases now 5,40,720 in the country. But just in the last 24 hours, 56,211 cases have been added. So India every day is adding more than 50,000 cases. Deaths, the mortality rate remains more or less constant. Deaths in the last 24 hours are 271. But with no let-up in the rising COVID cases and hit by what many are now calling a second wave with over 50,000 cases in the last 24 hours, the centre is urging states to ramp up testing and tracing to keep the virus in check. But is the country better prepared now than they were 1 year ago for a COVID virus wave? It's our top story tonight.
From poor to very poor. In a span of weeks, India's coronavirus situation has deteriorated drastically, a fear echoed by the Health Ministry.
We are facing increasingly severer, intensive situation, more so surely in some districts, but the whole country is potentially at risk, and therefore all efforts to contain, to save lives should be taken.
Without glasses.
India in the last 24 hours reported more than 56,000 new COVID cases. But the magnitude of the situation could be understood by the fact that India has recorded its last 1 million cases in just last 30 days.
The virus is still very active, can penetrate our defenses. We can have all the vaccines in the world, but we will for a long period of time need to be also dependent upon masks to protect us, protect our families, protect this community.
Centre has asked states to ramp up its testing and tracing mechanism and has urged private hospitals to play a bigger role in India's vaccination drive.
We are seeing only less than 6,000 vaccination sites are being run on a daily basis on an average by the private sector. The registered number of private sectors is much more, perhaps about 20,000 to my knowledge. So we want a greater participation because we want to, shall we say, accomplish this job the quickest possible time.
With Milan Sharma, Bureau Report, India Today.
So how should one be dealing with this second wave of the coronavirus? I'm joined by the country's top epidemiologist from Vellore, Dr. Jaiprakash Mulyal joins me. Appreciate your joining us, Dr. Mulyal. When you see this rapid surge in cases, the country adding more than 50,000 active cases a day, should we be surprised? Should we be alarmed with this sudden rise in cases? How do you respond?
Well, whenever certain patterns emerge, it is quite annoying and worrying. But let me tell you something. There was a logical reason why this rise took place. You know, in September when the cases were coming down, it was quite surprising because we had not yet reached a level of herd immunity. Even in urban clusters, in many of them, they expected 60%. So I think what happened was our population was quite dimorphic. In other words, there are two people. One group very careless or couldn't afford to be careful. And then they got infected, and that is the rise we saw first. But there was a group, educated, well-to-do, who could afford to wait it out. And they were permitting the herd immunity to act earlier than expected. In other words, the virus was not finding enough host. But I think they changed, their behavior became a little more relaxed. And this whole rise is mainly occurring in areas where previously the incidence of disease was low.
Now, I want to understand what you're saying, Dr. Mulyal. Are you saying that the rise is only due to COVID inappropriate behavior and not because there are new and potentially more dangerous mutants and variants that are coming in?
Well, I pointed out to one of the reasons, that is our own behavior, which we have seen happening in the media, people walking around without any protection, and crowds being gathered together. So that was expected. But the point is, even people who were cautious earlier, when they saw this declining trend, I think relaxed a bit. That's number one. Now coming back to this question of variant, we have to live with variants all our life. So you can't be frightened of variant. The thing is, it is quite possible there may appear a variant which ignores the immunity granted by the earlier infection. Now that would be quite upsetting. Till now, we haven't seen any evidence. Practically all infections have been on previously uninfected people. There are some variants who transmit faster than the old virus, but that shouldn't bother us. The problem will be if it changes the clinical profile and seriousness of that illness. It hasn't been established yet. So I don't think we need to press any panic button. And my guess is, if you look at the number, the same way it has gone up, it will come down.
You're making an important point. You believe that the numbers will come down in a few weeks. This is part of a pattern. But are you still confident, doctor, of something you told me a few months ago, that we were inching closer to herd immunity? If we were, then what explains this recent surge?
Yes. The reason is we are asked the question, why did the number of cases come down in the first place? What are the reason? And the reason was that people once infected were immune to future further infection to a large extent. So the virus was not finding new homes. But new homes came as a present because when we started relaxing our norm, then the virus could spread again. So I think the herd immunity is something that is there for certain. And that prevents outbreaks like it's a standard norm. The point is, when large clusters of people who have been very careful come in front of the virus and expose themselves, then the outbreaks can be very large. Remember, it's a very large country, and our expectation was 60% should become immune in the cities and 40% in the rural area. These are fairly rough estimates, but by and large, we expected the herd immunity to set in when half the country is infected.
You know, you're saying though, doctor, that there is no need to press the panic button. But the question is, what should one do as policymakers when the cases are rising? There is one view that we need a re-lockdown, especially in cities like Mumbai. The other view is that what we really need is a speeding up of the vaccination process. Which, according to you, is the best way forward? Much faster vaccination or another lockdown?
I would vote for speed up the vaccination process. And we have the vaccines, luckily, and I don't think we are in short supply or anything. And we have a system which can deliver it. Lockdowns never helped. Now, lockdowns help in certain countries where they could afford to have lockdown. In India, that is not so. Remember, every day we lose something like 250 people due to COVID. But there are many other people who die because of other illnesses. And you go through an unrestricted lockdown and prevent people from reaching hospital when they need, the livelihood is affected, that'll be a greater disaster. I think some sort of a restraint on people meeting, gathering together, traveling together will be helpful. Remember, this subset of the population who are really being exposed now are the ones who were careful to begin with, patiently waited, and now the vaccine has come, their wait is almost over. Right. It's a pity we had to face the outbreak again.
But Dr. Mulyan, we know of cases of people who have actually got vaccinated, particularly the first dose, and are now getting reinfected in some instances. Should that not be worrying that there could be variants out there that are bypassing the vaccine also now?
No, remember, the vaccine is primarily aimed at reducing the chance of serious illness or death. The logic is based on the fact if an individual is previously exposed to the protein, his cells will remember them. So when actual virus comes in, even if it stays for a short time, it cannot cause disease because the immune response will be excellent. So what we need from the vaccine is truly reduction in serious illness and death. And these vaccines are clearly providing it. Reinfection is not an anxiety at all. It is in a sense that we wish it didn't even allow the virus to occupy our body. But not having that is not a serious background. Remember, natural infection imparts a very solid immunity, and reinfection after natural infection was extremely low for certain biological reason. But the vaccine also provides good immunity without having the risk of people dying. So I think we have reached a phase where judicious use of vaccine and a little more restraint for a short more period of time, we should be able to go through this business without any panic.
Dr. Mulyal, the other concern is why is it that only some states like Maharashtra, Punjab, Karnataka seem to be reporting, Gujarat reporting a high surge in daily cases, half a dozen states accounting for 78% of the fresh infections. Why is it that only some states seem to be affected poorly? Because inappropriate behavior is all across the country. So why do some states only see a surge?
Yeah, it depends on this clustering of people who live a secure life. In certain cities, even when we looked at specific areas of clusters and compared within one city, there are some clusters with very high seropositivity, certain other clusters low positivity. So there are emergence of these clusters for socioeconomic and educational reasons. And there are large clusters. And if you notice, certain parts of the Maharashtra are down, but certain selected districts are going up. And I think historically, during the last 1 year, those areas had lower incidence of
So net, doctor, are you saying this wave is far milder than the earlier one? Many asymptomatic cases who are recovering within 4 to 5 days, mortality rates still at the same level as the past. No need to press the panic button. Is that what you're telling me now in conclusion?
Well, every time there are new strains coming up, you have to watch out. If the virulence is increasing, is virus misbehaving. Now, even now, a large percentage of cases are subclinical, which is comforting thought. Similarly, the mortality pattern also has not changed noticeably, okay? But I'm sure the Ministry of Health is keeping a watch over it. And as far as I can see, it is still the very elderly who is succumbing to this infection.
Right.
So there are more deaths, of course, because there are more cases. But it is, remember, India was fortunate that we had a much lower death following infection compared to many, many other countries. And that's true of not only India, many other South Asian countries in Africa.
So if we were to speak 1 month from now, doctor, you're confident we will be in a much safer zone, that the worst will be over in a month from now?
I am positive.
You are positive, Dr. Mulyal. So you're giving us a positive message. The next month, crucial, maintain COVID appropriate behavior, but step up vaccinations. That's the key. Appreciate your joining us, Dr. Mulyal, as always, on the news today. Now, remember, with this surge in cases, it's Maharashtra which is under the scanner because the state is actually considering a potential lockdown. But it's a divisive issue. Opposition from all quarters, including Shiv Sena allies, and the business community. Take a look at what is happening on the ground, because ventilator beds in the city are now becoming a cause of concern.
Maharashtra is clocking over 30,000 COVID cases every day. The situation continues to be worrying in cities like Mumbai, Pune, Nagpur, Nasik and Aurangabad. The new surge has prompted the Uddhav Thackeray government in Maharashtra to consider another lockdown. But the idea is being opposed by one and all.
निश्चित रूपाने लॉकडाऊन हे राज्याला जनतेला कुणाला परवडणारा नाही. आम्ही सर्वांनी मुख्यमंत्री महोदयांना आग्रह धरला की आता लॉकडाऊन हे उपाय होऊ शकत नाही.
लॉकडाउन करो, नो प्रॉब्लम. आप पैकेज दो, चलो 1 महीने के लिए पैकेज दो. सभी ठेले वालों को 5,000 रुपये मिलेंगे, घर में काम करने वाले ताई को 5,000 रुपये मिलेंगे, रिक्शा वालों को 5,000 रुपये मिलेंगे. फिर करो ना, लोग घर में आराम से बैठेंगे. आप कुछ करेंगे नहीं तो 2 समय का खाना क्या खाएंगे? कोरोना से नहीं मरेंगे लोग, भूखमरी से मरेंगे.
Nagpur, Nanded and Beed districts are already under a lockdown. Sources tell India Today the new lockdown, if it is imposed, wouldn't be the same as the one last year. A complete shutdown of buses and trains is unlikely. Services other than essential ones might be allowed. Private offices may not be asked to be shut down, unlike last time. Government offices are already asked to work in staggered shifts. There might not be restrictions on movement of people. With COVID cases rising sharply, the BMC is taking stringent measures. The civic body will manage 80% isolation beds of private hospitals. All ICUs of private hospitals will be managed by the BMC War Room. Asymptomatic patients with no comorbidities will not be given a hospital bed. The BMC has instructed discharge of all asymptomatic patients. All jumbo centers have been asked to operationalize their wards. 69 nursing homes are converted to COVID centers, adding 2,000 beds and 400 ICUs to the total tally.
ये जो लोग जो सिस्टम को ब्रेक करते हैं, जो हमारे सिस्टम को फॉलो नहीं करते, उनको मेरी यही रिक्वेस्ट है कि आप सिस्टम में रहिए. अगर सिस्टम से बाहर जाएंगे, यू विल बिकम फिश आउट ऑफ वाटर. आपको बेड नहीं मिलेगा. तो ये कारण है कुछ लोग बोलते हैं बम्बई में बेड नहीं है.
On one hand, COVID positive cases are increasing alarmingly, pushing for the need to take stringent measures. But on the other hand, political parties, including the one that are part of the state government, are opposing any move like lockdown. The state government for now is stuck between the devil and the deep sea. With camera person Vaibhav Kangutkar, Kamlesh Sutar in Mumbai for India Today.
Okay, let's go straight across to our special panel on this big question. Has the time come for a lockdown, or is vaccinations the way forward? Dr. R. Ganga Khetkar, one of the country's top scientists, former head scientist at ICMR, is joining us. Dr. Hemant Thakkar, consultant physician and one of Mumbai's top doctors, joining us. Dr. Shashank Joshi, member of the COVID task force in Maharashtra. Let's come to each of you on that big question. I'll start with you, Dr. Thakkar. Has the time come for a lockdown, or is it better to just increase the pace of vaccinations in Mumbai, Maharashtra and the country?
See, this entire COVID carriage has to be drawn by 2 horses. One is the discipline and the other is the vaccination. The old adage that spare the rod and spoil the child is not faulty. As our epidemiologist very correctly described to us, we had a warm Diwali, a Merry Christmas and a Happy New Year. And we all celebrated, and that's where the explosion of weddings, gatherings, Maldives, Dubai, holidays, Goa, everything burst on the scene. So we are seeing a surge, and this is not a surge, this is a wave, a tidal wave. And it is this wave that is going to produce herd immunity, because all and sundry, the penthouses in the skyscrapers and the garages down, all of them, we are getting hordes of people positive.
No, so do we need another lockdown? Are you saying the answer is another lockdown? Or is it simply to start vaccinating much faster all age groups?
We have been vaccinating, but you can't only pull the carriage vaccination. There is no discipline. You probably do need a small lockdown, a short lockdown. Because if you don't break this chain of transmission, a circuit is broken. You're not going to allow, because this is a mutant virus. And mutant does not mean bad virus. Mutation means changed. Our reports are showing that the cyclical threshold score in all the positive patients shows a low value. And a low value is bad. But all these patients with low value are relatively less symptomatic against what we saw last year. So this is a mutational behavior. And as the epidemiologist said, we are seeing milder cases, majority asymptomatic, milder cases. But what all that we are remembering only is the panic of last year, and people call to say, I have diabetes and I have a positive virus, I need a bed. So you need to regulate the beds, you need to prevent the transmission, and the only way you can do it is to have a restricted activity movement. So whether you call it a lockdown, whether you call it a complete lockdown, but people do not remember there has to be something to break this chain, and if you spare the rod, you're spoiling the child. Because this mutant virus is tame just now, but if it gathers speed, it can mutate it in upward fashion. You could have virulence going up.
Let me take that to Dr. Ganga Khedkar, because Dr. Ganga Khedkar, you were spearheading in a way the ICMR's outreach when there was the first COVID virus last year. Do you believe, like Dr. Thakkar, that we need a restricted lockdown in Mumbai, Pune, across Maharashtra and other parts of the country where cases are surging?
I think it's a tough decision. Now, one thing which science will tell you, that lockdown in the first wave was little logical because the seeds of infection had not perhaps spread across. Now that the first wave is already over, we know it had reached every part of the country. Given that fact, a complete lockdown of the country is absolutely not feasible. It would perhaps have an adverse impact on economy along with the health outcomes that are also likely to be affected. The issue, perhaps, can we have a statewide or such a kind of lockdown? Perhaps that kind of lockdown also I don't think will happen, because when you put up a lockdown and when people are sitting in the house, just imagine the infection has already spread across. A case which is positive is likely to stay back in the household and is more likely to infect others. Perhaps the best answer is the calibrated lockdown that is being tried. You have areas where you are doing containment. There you can actually try and ensure that the mobility is restricted. The person, if he cannot stay or she cannot stay in the household because the house is small, safe distancing or COVID appropriate behavior may not be possible, shift that person to institutional facility where that kind of facility can be offered without affecting
Dr. Ganga
the person's...
But Dr. Ganga Khedkar, how do you achieve that? There have been attempts made at restricted lockdowns for particular areas, containment zones. We've seen that happening actually over the last year. Do you believe that that can succeed? How do you break the chain? To take off from what Dr. Thakkar said, the need to break the chain. How do you break the chain, doctor?
Now, there is one thing which I would say. When there is the number of cases increases tremendously, it puts a huge amount of strain on the public health infrastructure to do testing as well as contact tracing. I know at one hand, doing contact tracing, trying to find out a case and then shifting them is going to be as challenging an activity. But at the same time, is there any other hope that we have which can perhaps break the chain of... We don't see one. Even if you vaccinate, we know vaccine loses its efficacy significantly when it comes to breaking the chain of transmission by way of reducing the risk of acquisition of COVID-19. It is not as effective as it should be when it comes to that. It's effective only in reducing the severe COVID incidence and also the death that is consequent.
You're making a very important point, Dr. Ganga Khedkar. You're saying the vaccines cannot break the chain, so you need something more. Dr. Thakkar, before I come to Dr. Joshi, you want to add to that, the vaccinations cannot break the chain. I think many people, after taking the first dose, felt as if they had conquered the coronavirus. I know people took the first vaccination and felt that they were now immune. Is that message not going through, that a vaccine is not enough? As Dr. Ganga Khetkar says, vaccination cannot break the chain.
I entirely agree with Dr. Gangadhar, and I have a large percentage of my patients who took the vaccine on Monday and grew positive on Friday. And if you go to some of these centers where vaccination is being given, before they enter the center, there is a bunch of people grouped together in a celebratory mood because they are going in for the vaccination. And when they come out from the vaccination, it's party time. And there they rub shoulders with each other, and on the 4th and the 5th day they test positive, and they want to blame the vaccine for it. So I think there has to be some discipline exercise there. And just because you've been given one dose or even 2 doses doesn't mean you're going to break the chain of transmission. But you need to either or immunize 40% plus of the population.
Right. Because, you know, the worry, Dr. Shashank Joshi, is even Maharashtra is not vaccinating fast enough. If I look at the current numbers, some estimates say if we continue like this, it will take 10 years and more for 70% of the population to be vaccinated. We're just not vaccinating fast enough. There's not door-to-door vaccination, not available for all age groups. We're not vaccinating fast enough. What is the Maharashtra government strategy? Lockdown or vaccination? You're advising the Chief Minister. Everyone wants to know, does Mumbai go for a lockdown, or do you believe speeding up vaccinations?
So certainly lockdown is not a strategy to Mumbai. Lockdown may be actually counterproductive. So I think what we need to do is stringent public health testing, tracing, strict zero tolerance for COVID, non-appropriate protocols not being followed, as well as vaccination is just one strategy to save lives or mitigate hospitalizations. What vaccination will do in the short term would be definitely to ensure that you get mild disease or asymptomatic disease. So vaccination, the most vulnerable group, is our first priority. And I think Maharashtra is now leading the country in the vaccination in numbers, of sheer numbers. And I think they need to do it and ramp it up further and do 24-hour vaccination in the
So are you saying lockdown is not an option for Maharashtra? Are you very clear about that?
See, if the healthcare infrastructure gets overburdened, there won't be a choice. But I don't think that is an option. Micro-containment, testing, tracking is a better strategy. So I think what Dr. Ganga Khetkar was adhering to, a calibrated form of a restricted lockdown-like policies will have to be adhered to. You cannot go for a total lockdown at all, Rajdeep, unless and until the whole healthcare infrastructure is overwhelmed with cases. Currently, we have sufficient beds available in Maharashtra state as well as in Mumbai, but the rate of growth is worrying, and therefore we need to apply a circuit breaker. And that circuit breaker will need innovative strategies, and definitely we need to strictly adhere to the public health measures on an emergency basis with zero tolerance policy for non-adherence.
I take that, Dr. Joshi, but Maharashtra has tried that. What has happened? Zero tolerance for violators is not working clearly.
Well, but I don't think lockdown is a solution for that. I think, you will need to do micro-containment. We will have to get a little more aggressive. And I think what the Chief Minister said is that get ready for preparing for a lockdown. So he has given 2 weeks or 3 weeks clearly for the city and the state to prepare, that follow the COVID appropriate norms and ensure that there is COVID appropriate behavior and ensure that the protocols are not violated and try to stay at home as much as possible except essential services. Otherwise, the healthcare infrastructure will be overburdened. And currently, one important thing, Rajiv, we need to realize, the less exposed population has got COVID. The more exposed population in the lower socioeconomic strata is still having better antibody status. But it is the middle class and the neo-rich class which has got COVID. Therefore, the private infrastructure is full, while the public infrastructure is still available with lot of beds available there.
You're making a very important point. The neo-middle class and in a way the affluent class are the ones getting more affected. Dr. Ganga Khetkar, in a sense, where do you stand on this? Are we reaching some level of herd immunity among lower middle class, among lower income groups? And now what's happening? It's the upper middle class and the affluent groups who are now more susceptible. Do you agree with that?
No, it's little difficult. I might differ on that particular issue, mainly because, herd immunity is a ever-chasing kind of a concept, given the fact that variants can emerge, variants can still keep on infecting. though so far what we have understood is the reinfection rates in the first wave were lower with the wild type infection that was occurring. But at the same time, there are reports that there are certain variants which could continue to infect you. And if vaccine is also not going to stop their infection, the only thing that we have to think about is not talk about herd immunity, but try to take the community together, try to ensure that they think that COVID appropriate behavior is the most appropriate thing for them to do, given the circumstances, that your mask is going to protect you, whether that is a wild type virus or whether it is a variant at this point in time. And what I feel is strong punitive actions alone cannot change people's behavior, because punitive actions are by and large challenged by the people. The best is to bring people together. Let the community come together. Let there be a community involvement. Only then perhaps you can change the behavior of the community for at least a short term or a medium term that we are looking forward to.
You know, let me take that to you, Dr. Thakkar, in conclusion, because the fact is that taking along communities is easier said than done in cities like Mumbai. People want their businesses to go ahead. People want to go back to offices. People want to go back to work. They want to go back to life. They thought they could a couple of months ago. Now you're telling them, look, things have got bad again. How do you put restraints on people who want to go on with their lives? I mean, you know, how do you stop in a city like Mumbai people getting on with their lives, often living in very crowded, congested localities?
How do you tell people who are coming to you with positive reports and symptoms that I have no place? How do you treat people when you're overwhelmed? Why do you do and where do you take patients when the beds are less, when the nurses are scanty, and when people are running filler to post? People have to understand that there is a carrot and stick approach. If you want the economy to go on, you have to learn to behave. We have, since the last 3 weeks, ever since the graph off, we've been telling people to behave. Either you have captains on the road fining them, but I have yet to see, I travel to 4 hospitals in the city, I have yet to see anybody stopping anybody to fine them for not wearing a mask. So discipline has to be imposed at any cost. And if you cannot filter out at the smaller level, you have to do it at a little larger level. I'm not saying you announce a lockdown like April 2020, but you certainly can have a containment. Okay, this is the zone which is exploding. For 5 days, do nothing. We found that 2 days the numbers were lower because of Sunday, and on Monday there was Holi. So people didn't venture out. The numbers were lower. So you need a small holiday for people to not mingle, for people not to go out, and not to be carefree and daredevil. And that's something which you will need to do, because otherwise the numbers will keep growing.
So a restricted, very, very focused lockdown seems to be a potential solution, even while the vaccination drive is accelerated. We'll see how that works, but for now I appreciate Dr. Ganga Khetkar, Dr. Thakkar and Dr. Joshi for joining us, because clearly doctors provide the solutions in a way that politicians cannot. I just hope that our politicians are listening to our medical professionals.